Alrighty, well, good evening, folks, and thank you so much for being here tonight. We are so thrilled that you have decided to spend your evening with us, and we are just so excited to talk a little bit about the School of Nursing and the different programs we offer through the School of Nursing here at Regent University. So first and foremost, I just want to thank you so much for being here. I'd love to introduce myself. My name is Mackenzie Rivers. I am an enrollment coordinator here for the university. I work out at the beautiful state of Georgia, and I help serve our students down here at the Southeast Coast. And I just love the opportunity to be able to just spend some time with you tonight and again, talk about what we offer. A few house rules before we dive into today's presentation. Zoom webinar platform can be a great feature as long as we're able to use it to its advantage and to the best of our abilities. So a couple things I would love to point out to you before we get started tonight. You will see on the bottom of your screen, could be on the bottom, could be on the top, a couple different icons. The first icon you will see is the chat feature. This is a great way for you to be able to connect with us as panelists. If you have any questions for us, or if you wanted to maybe put something out in the chat for everybody to see, this is going to be the place to do it. So what I always love to do before we get started is let's go ahead and try that. So if you guys all want to find your chat feature box, you can type in a little message, make sure you're sending it to all panelists and attendees. And you can say something like, hello, I'm tuning in from Savannah, Georgia, and you can send that. So I'd love if everyone wanted to take the opportunity, and we can kind of go through and see where everybody's joining from today. These webinars have been amazing in the past. We see so many people joining from so many different locations, so it's a really amazing opportunity. We got some people tuning in from Virginia Beach, Fort Meade, Maryland. Again, another Virginia Beach, awesome. Some Georgia folks. Okay, awesome. So as you can see, wow, that's amazing. So as you can see, and you guys should be able to see it, if you're not, that's okay. We have a lot of different folks tuning in from a lot of different areas. So it's an amazing way that we're able to all come together under one roof while we are in this very unprecedented times. The second feature is going to be our Q&A feature. This is going to be a great opportunity for you to place any questions that you have specifically related to content. Now, I know oftentimes people will just find the chat feature and put their questions in there. Now, if you're asking a question about content in the chat feature, a lot of times it will get unread. But if you do place it in the question and answer, that will give myself or a panelist the opportunity to respond directly to you. So I always find that's just the best way to do that. Other than that, I always just love to ask, and I plead for some grace. We are all in our individual homes, and we are all trying our best just to be able to put this presentation on for you, again, while we are in our homes. Our families are all in the other room, you know, having their evening dinner, watching a show, so just please have grace with us. But without further ado, what I would love to do is welcome up the Dean of the School of Nursing, Dr. Lee, and she's going to talk a little bit about just everything that we have to offer here at Regent University. How are you doing, Dr. Lee?
Hi, I'm so great. Thank you, Mackenzie. Thank you for having me, and it's so great to meet everyone virtually. I am actually in Oklahoma right now, so
oh wow,
yeah, so we're literally all under one roof all over the nation.
absolutely. It's such a great opportunity to be able to connect. But Dr. Lee, I would love if you take a few moments just to share a little bit about yourself before we dive into tonight's webinar, if you don't mind.
Yeah, sure. Thank you. So my name is Becky, and I am the director of the School of Nursing here at Regent University. I've actually been in nursing for about 24 years. I started out in labor and delivery, mother, baby, newborn nursery, postpartum, all of that. So I've only ever done labor and delivery, which would be nice for everyone. If you don't mind, go ahead and put in the chat which area of nursing you work in. It would be fun to see what kinds of different units everyone is representing. I know that Priestley Williams, who's also on the call, his background is in hospice. So, but my background is mother baby, and actually my experience is really only in that, although I've done everything within mother baby. So I've been the lactation consultant, I've been the childbirth educator, I've done home health, and that's really my love and my passion, my calling, I guess you could say, is working with mothers and babies during childbirth. And I've been all over the world. I've done lots of mission trips. I've been I've opened up medical clinics and done dentist clinics, and I've worked with orphanages in Bolivia, Dominican Republic, Africa, Vietnam, Korea. So you can kind of read a little bit there about me in my biography there, that I have a heart for missions, and I love specifically working in the orphanages to change the lives of the newborn baby. For all of us labor and delivery nurses, we know that that first year that they have within their life, the from newborn to 1 year, is their most important year developmentally. So what I like to do is to go into the orphanages and teach the caretakers how to affect and impact the child's gross motor, fine motor, developmental, emotional, psychological, cognitive problem solving skills. And then that, and it's just easy stuff, and then that in turn impacts the child's life. So my heart is for the mission and for the world and the nations, mother baby specifically, but newborn nursery education and childbirth education, patient education, is what led me into academia. So I identified my love for teaching early as a nurse when I could see the difference that it was making for people's lives. And especially when you're in their home, like doing home health, that was a really amazing experience, because you can go in the home and you can see the kinds of things that need to be changed, and make recommendations to improve the safety of the child and the mother and the entire family. And so I love doing that. And then my love for education and making a difference led me into teaching mother baby care to new nursing students. So it was kind of like at that moment when like a job became available for me to teach in a nursing school, is when all of my passions and my love came together. So I've been in nursing education and nursing academia for, I guess it's been the last 14 years of my career, but I've continued to work in mother baby. I actually work in a mobile van right outside really rural areas where there's just a low point of access to care. And I do ultrasounds for vulnerable women, and they get to see their unborn baby. And, we do a very limited ultrasound, but we can still see how far along the baby is and make sure the baby's in her uterus, and just do some preliminary workup, and then help with those social determinants too, that help get the patient and the baby the resources that they need to maintain a healthy pregnancy. So that's kind of a long story about me, I guess you could say. I also have 5 children of my own, and I love kids, and I love nursing. I'm very passionate about nursing. I'm very passionate about nursing education. I truly believe that nursing is a calling. And because of my love for nursing and my calling as a nurse and the experience that I've had, my hope and dream is to inspire other future nurses to make a difference in the world.
Absolutely. I loved how you shared all of that. And folks, Dr. Lee probably doesn't even realize, but she touched exactly on what I wanted to share with you tonight. You will find that with all the faculty members that you meet here at Regent University, they didn't just get their bachelor's degree, master's, doctoral degree, and then they started teaching. These folks have actually been in the workplace field for many years before their hearts for education came about. And one of my favorite things about that is our goal is really to make you workplace and industry ready. So that's something that we value very highly here at Regent University, is we want you to be learning from the people who have been in the ruts, and they've been able to see and experience things bedside that a lot of people who maybe just went into education hasn't been able to experience before. So I love everything that you shared there, Dr. Lee. If you guys have any questions specifically about Dr. Lee's biography, anything she shared, if you want to know more information about her, go ahead and put that in the Q&A feature, and we would love to talk about that at the end. Just as a reminder, after we do go through our presentation tonight, we will be doing a live Q&A, so that would be a great time for us to be able to discuss a little bit further. But I'll pass it back over to you, Dr. Lee, and you can share a little bit about who we are as Regent University.
Sure, thanks, Mackenzie. So yeah, this is kind of 6 points that I think identifies and describes us really well. We're accessible, we are affordable, We have good transferability, high quality, flexibility, and we are Christ-centered. That pretty much sums it up. The accessibility and the affordability and the transferability, I think, are things that students have really recognized in us. And I've had graduates say that they've come to us just because of that. We will transfer in up to 90 credits too of your RN to BSN program. So you can come into the nursing program with your RN license. You'll get 60 credits for that, unless you have a diploma, and then you get 40 credits. But you can get up to 60 credits just for having your nursing license for electives. And then if you've already taken college classes, you can transfer up to 90, which basically leaves 30 credits left that you have to take in your nursing program. So you're not going to find a more accessible, affordable, and easy, I don't want to say easy, but easy to get into, or accessible, meaning that we recognize the college classes and the work that you've done prior. 90 credits is very generous. And so, to walk away with potentially a 120 degree program, having only taken 30 with us, is really remarkable. And so again, with that transferability, we do a lot of course substitutions too. So we'll give you credit for courses that transfer in as different courses for Regent's bachelor's program. And so we recognize that, and we've worked really hard to make sure that the registered nurse is recognized for the high standards, their high accomplishment, and the impact that they're already making in the world by having the registered nurse license. And so I think that's something that the students can kind of just take a deep breath, prospective students, and know we're going to do everything we can on the front end to make this flexible and affordable and accessible to you. And we've had our graduate students say that to us, and I can give you more specific examples of that. Regarding the high quality, we are CCNE accredited. Our RN to BSN program has received the maximum number of years that we can for our accreditation through the Commission on Collegiate Nursing Education. And the CCNE came and had a site visit this last February for our MSN program because it's a brand new program. So what the CCNE likes to do is to have you have students in place at least a year in advance before they come on site, so they can see how you're doing things, see what the students say, look at your curriculum, look at your assessment plan, and so forth and so on. So they came in February, and they had actually a lot to say about us that was so amazing. But what they looked at, Mackenzie, was they looked at our mission, they looked at the governance of the program, the institutional commitment, they looked at our resources, curriculum, teaching, learning practices, and our program effectiveness, meaning how do we measure whether or not we're doing what we say we're going to do. We call this assessment and achievement of program outcomes. And they had 0 recommendations for change. I've never seen that happen in all of my years of nursing education. They literally walked away from our campus and said, "You don't need to change anything." It was so remarkable. They found that we had met all of the standards, we had met all of the compliance areas, and there wasn't anything that they recommended that we do differently. And so we got 100% score on that, and their board will make a full decision on that this fall within the next month, and then their decision to accredit us will be retroactive to February, meaning that February 2020, so meaning that all of the students that are coming in now are basically grandfathered in to that process. So yeah, I mean, you can't find a higher quality program than that, honestly. And we are Christ-centered, and I have to say right off of the top, that is the favor of the Lord. The nursing program is God's program, and we are here because of His calling. Nursing is a calling. We weave Christ into everything that we do, and we do it unapologetically. So, for students that are kind of on the border of where we are or where that stands with them, we're not going to push it on you. And that's definitely not something that you have to have a relationship with Christ or have accepted Christ as your Savior to get into the program. But please do expect to see us talking about Christ in the program and reflecting on his mission and who he is as a person, and then how that in turn should reflect through us to be his light and to be his hands to a hurting world, especially right now. With everything that's going on, we have such an opportunity to minister to people. And in nursing specifically, and I know the nurses that are on the call can relate to this, we're there at moments where nobody else is there. We're there at the patient's bedside in life and death situations. And to be grounded in your faith and to be mentored in your relationship with Christ is invaluable. And our hope is that, again, like I said, that we can take our passion that we have and help our students to be passionate, and then they can be the Christian leaders to change the world.
Absolutely. I love what you said about just our programs in general, and how we receive that highest level of for the accreditation. And it just goes to show folks how, this may be a new program, but we didn't cut corners when it came to it. It was something that we had been developing, and especially Dr. Lee has been developing it and dreaming about it and praying about it for many, many years to come. And again, it just shows the Lord's favor and how important it is that we get more Christian leaders into the nursing field. So I love that. If you wanted to touch a little bit about your commitment to these students as, the director of the School of Nursing, I would love to hear what you would have to say about that.
Sure. Yeah. I mean, we've kind of already talked about that and covered that. To be the most influential Christian nursing program in the world, our vision is to be the destination of choice. So not just Virginia Beach or Oklahoma or Georgia's, preference, but to be the destination of choice. And we do that, Mackenzie, through all of the things that we've talked about, making sure that our policies are flexible, looking at the quality of what we're teaching, looking at how we treat one another, and looking at how we treat our patients. We also incorporate in spiritual care to all of our coursework. And we have just an entire philosophy of holistic nursing care, meaning that we're teaching the nurses to take care of the patient's mind, body, and spirit. And if one of those pieces are left out, then the patient really isn't getting the best experience that they can. And we know, and we have research and data to show that when patients can find meaning in their illness or can find purpose in whatever outcome has occurred, that's where health begins. So even in times of illness and even in times of sickness, we can help bring light to a hurting world. And there's good things that can come from those disturbing events too. So again, when we're asking our patients, doing a physical assessment, but also doing a spiritual assessment, then we open up the door to have that conversation with our patients about, where does your hope come from? Where do you find meaning? And pulling out questions and a lot of open-ended questions with them to help them find their faith and to find meaning in that event. And it's really powerful. It's, again, we're not really doing good nursing care unless we're practicing holistic nursing care. And even when we're caring for ourselves, the holistic approach, I think, is really a distinctive of who we are and becoming the destination of choice. There's so many nursing programs that will just cover the physical or the mental aspect. But what about the spiritual aspect? And, for me in my walk with Christ, I can say my relationship with the Lord and the purpose that I find in being a nurse is everything to me. And I'm sure that of the participants that we have, they can relate to that, because as you talk to nurses, you'll find a similar thread that we care. And did you know we're the most trusted profession? Gallup poll has called us the most trusted profession for 18 years, number one in America. There's a reason for that, and that's because we care. And we shouldn't just be caring for the body, we should also be caring for the spirit. So you're going to see that holistic approach intertwined. Now, for with also additionally, when you're caring for your patients, that spiritual emphasis, we want we want to be representing Christ, but again, you can provide spiritual care regardless of what the patient's religious preference is, and you can make a difference. And we've actually seen so many amazing miracles come out of that when you really dedicate your profession to Christ, and you dedicate your profession and your practice to holistic care, and you turn it all over to God. That moment, that you walk in the front door of the hospital and you give it all to Him, and then you start hearing His voice, and you practice your gifts, your spiritual gifts, and you display the fruits of the Holy Spirit, miracles happen.
That's awesome. Thank you so much for sharing that. That's so just encouraging to hear. Folks, I know that you were sharing a lot about our hearts behind the program, but what we would love to do now is just take a couple moments here before we dive into the Q&A and talk about the meat and potatoes of the webinar, kind of, the two different programs right now that we're offering and kind of the outcomes of those. So I will not be covering that because Dr. Lee is here and she is the expert in these programs. So anything to add on this slide, Dr. Lee?
No, I think that's great. The $295 a credit hour is very competitive. And when you couple that with the $5,000 Healthcare Hero Scholarship that we are offering, you're not going to find a more affordable program. And I know that because I've done the research, and I can say that we are the most affordable nursing program that I've been able to discover. If you find one cheaper, I would be a little bit concerned for their program in and of themselves. But we are very affordable. Again, you have 30 hours of BSN specific coursework. And the admission requirement basically is that you have a registered nurse in the state of practice. You fill out your application, you turn in your transcripts, and it's 100% online. We do have some shadowing experiences in the RN to BS. So there's two classes, community and leadership, that you will shadow a preceptor. So you're learning about community nursing. So that might be in a health department, or that might be like on the mobile van with me, out on the streets. You can kind of pick whatever you want to do. But we also, because of the pandemic, have been offering a lot of virtual options for that too. So we can offer digital simulations rather than following a mentor if that area is closed. So there's a lot of flexibility in even the clinical hours. And so that's an option as well. But I do want to make sure everyone knows that typically there is some hands-on learning with that. But because of the pandemic, and sometimes there's just certain situations where our nurses can't go into the field or into the practice setting for whatever reason, and we do have alternative assignments for those. Our learning outcomes are to assess pathologies, communicate, learn the techniques, discover how health information systems and data management provide safer patient care, and to train to make important caregiving decisions with Christian compassion.
That's awesome. And I know, just being on the admission side of things, on the side of that house, do you mind explaining a little bit when it says why it's so important to have, a good license, an unrestricted license in that particular state? So let me ask you this in a question format. Are these students, once they graduate for this program, are they being licensed in the state of Virginia, or would it be their own hometown or home state?
Sure, it's their own hometown, and they can have a license anywhere.
Sure.
So if you're in Georgia, you can take our program from Georgia as long as you have a license to practice in Georgia.
Yeah.
And that's because you are doing some shadowing with a preceptor, and in order to even get into a healthcare setting, you have to be a registered nurse.
Right.
And you have to have an unencumbered license. And an unencumbered license basically means that you haven't had any disciplinary action from the Board of Nursing based on maybe something that could have gone wrong at some point in your practice, or like a malpractice event, or substance abuse, or an arrest of some sort. And so that license needs to be clear so that you can practice, and so that you can engage our curriculum to the fullest extent. One thing that's not on the slides too, that I think that everyone should know, is that there's no prerequisites for the program too.
Wow.
So everyone can come into the program just as you are, as long as you have that nursing license.
That's awesome. I love that you're talking a little bit about how, because I know a fear of mine would be, well, this school is in Virginia and I want to practice in the state of Georgia. So that's great to know, and just to have the knowledge of that. And again, that just shows the accessibility of our programs. You really can do this program from wherever you're at, across the states. And I love the 100% online with that highest level of accreditation. Like you said, you're not going to get a better program at that $2.95 per credit hour.
Yeah.
It's really awesome to learn. Okay, perfect. Let's talk a little bit about the MSN.
Sure. So this is our newer program. And like I said, CCNE was here this last spring-ish. It was February. And our admission requirements are basically, again, the online application. You also have to have the unencumbered, unrestricted license, the written statement of purpose. And we do require a bachelor's degree for this program. The neat thing about this program, though, is that you could have your registered nurse license and have a bachelor's in psychology, or a bachelor's in social work, or a bachelor's in business, and still get into our MSN program. So you can completely bypass that BSN requirement and just skip to your MSN, as long as you have a bachelor's degree from an accredited institution. And we have several nurses right now that are in our program. What you'll have to do at the end of your MSN program is just to document how you've met the BSN essentials and the MSN essentials. And the essentials are the requirements that the American Association of Colleges of Nurses requires for each graduate student. And so you'll just have to express to us, meaning the nursing faculty, how you've met the bachelor's standards, and then how you've met the MSN standards, which usually is just a presentation that we talk about. We kind of talk about that together to make sure you have a good understanding of it. And then you can move on and you can get your MSN program and your MSN degree complete without ever even having your BSN. So that's a really unique feature about our program too, that I think is something that you won't see too many places. We do require a higher level admissions GPA. So it is a 3.0, and that's because it is a graduate program. And so there's a higher expectation. And you also do have to maintain a 3.0 GPA while you're in the program. So just kind of a heads up, that you want to make sure you get a B. Now, we do have flexibility there too. So if you get an A in one class and a C in another, that's okay, as long as it averages to a B. So you just need to be able to maintain that 3.0 average, but you can get a C in a class, and that's okay. It still counts for credit.
Do you mind sharing a little bit about the two different concentrations, and what individual would want to go into the educator route and maybe the leadership and management route?
Sure. Yes. So the nurse educator track is focused on really either the hospital nurse educator, the staff educator, the patient educator, the nurse educator for the floor or for the hospital, and then also nursing academia. So teaching in a nursing school. So it could be any one of those. It could be hospital focused, or it could be nursing school focused. So there's a lot of variety there too, and just depending upon where your heart is to teach and where you feel led to teach, because we need teachers. And we in the School of Nursing and then in the practice setting, nurses will teach regardless of what concentration you choose. We just do that. But within the nurse educator focus, you'll get more on like creating course outcomes and how to teach online, how to do simulations, how to teach in the lab, and then how to even write your own syllabus. And then all of that can be used even in the hospital setting to teach patients as well. So there's a couple of different ways that nurses can use the nurse educator concentration. And then the nurse leadership track is focused on like the nurse manager, the nurse leader, the nurse executive, someone who wants to become the charge nurse, or someone who feels called to become the chief nurse operator or the chief nurse administrator. Then the leadership and management track is going to be for you. I also like to mention that from our nurse educator track, you can go on to become a nurse practitioner. So within our nurse educator track, we offer an advanced pharmacology, advanced pathophysiology, and an advanced physical assessment class. And those 3 courses are required in a nurse practitioner program. So you can take those classes and potentially transfer them into like a postmaster certificate program and go on for your nurse practitioner route. So if you're thinking you want to become a nurse educator, but you're also kind of have a heart for maybe advanced practice, you're not quite sure where the Lord is going to lead you, then I would recommend the nurse educator track. If you want to become a nurse practitioner, or if you want to become a nurse educator, if you know you're headed towards administration, then go into the nurse leadership management track. And there are doctorate of nursing practice degrees that are focused on administration, so you wouldn't need the pathophysiology class. And that's another track in and of itself. But if you want to become an advanced practice nurse that is actually a registered nurse with an advanced practice license, then you need to pick the nurse educator track. Does that make sense?
Yeah, that makes so much sense.
Okay.
And I love just being able to hear the 2 different programs side by side. That's super helpful. The other thing I wanted to ask you was with the clinical requirements. Now, that's not something that, again, has to be completed in the state of Virginia. That could be done wherever the student's located, correct?
Yeah, sure. Yes, absolutely. And they can pick their own preceptor and they can
Wow.
pick their own clinical site for this. So again, it's totally flexible. In the
Yeah.
MSN program, what CCNE wants to see is that you identify a specialty, so something that you can market for yourself. So if I wanted to become a lactation consultant, then I would
Sure.
choose that for my preceptor.
Yeah.
Any You can choose any setting that you want as long as your preceptor has an MSN degree or higher. And that could even be a nurse practitioner. So you could work in a nurse practitioner clinic. And then what you're going to do within that clinical environment is find a workplace issue, and we're going to create a quality improvement project to help to repair that workplace issue. And
Absolutely.
it becomes a really fun capstone project.
Oh, I bet. That's awesome. I love hearing that, how it can be customizable.
Mhm.
This is something that we're all so excited about, and I just can't wait to hear Dr. Lee talk about it. Just this new scholarship that we have had just recently come up with, and if you want to share a little bit about it, I think the students and prospective students tonight would love to hear some of the heart behind it and kind of what our plan is with this program.
Well, we really prayerfully thought, how can we recognize the healthcare heroes? And I want to tell you, we came up with the name before the pandemic came about. And I don't think that was a coincidence either, because all of a sudden nurses are being recognized for their heroic, sacrifice of being on the front lines. Well, we've been doing that forever. So it's not just that we're just now heroes. We've always been heroes. So the Healthcare Heroes Scholarship the idea for that came about way before the pandemic ever developed. And then it was like, wow, the timing was so prophetic, but it's a way to recognize the nurses' sacrifice and the compassion. And I'm so thankful that now that we are being recognized. For goodness sake, we have been recognized as the #1 most trusted profession. We do a remarkable job, and we are the ones there always in the life and death situations where no one else will ever, will stand. And we're the voice for the patient, and we advocate for them, and we do anything for our patients. and that's just who we are. So it's a way for us to recognize what the nurses are already doing to make a difference, and to just say thank you so much. And I hope that it's received with the heart and the compassion behind it. It truly is a gift to recognize nurses for what they're doing, and to say thank you.
Yeah, and I know my first question would be like, okay, Dr. Lee, so where's the fine print? But after just hearing a little bit about the program and talking to students, there really is no fine print besides that October 26th deadline, correct?
Yeah. And, there's no plans to continue it after that. So definitely get on board now while you can.
Absolutely, folks. And if you are knowing that this is exactly where you want to be, I'll go ahead and ask John to put in the chat feature just how you can apply into the program. It's simply just regent.edu/apply now. Don't hesitate. A fun fact, if you actually wanted to wait until tomorrow and call into our office, oftentimes we can get an application fee waiver submitted for you. So you wouldn't have to spend that $50. You'd be getting that $5,000 scholarship. So definitely don't hesitate here when it comes to applying into this program. But what I would love to do now is just kind of go into a time of Q&A with you. Dr. Lee, if that's okay, I would love to just kind of ask a couple of questions here. And folks, while I ask some questions that have just previously come in, I would love to hear from you as well. If you wanted to go ahead and put any questions in the Q&A feature about what we talked about tonight, that would be so awesome. But first question I have for you here, Dr. Lee, is how long does it take to complete the MSN courses?
Sure. Yeah, it's about 18 months. It'll stretch a little longer depending upon how quickly the courses are taken. So I would map out about 2 years.
Perfect. And what about the BSN as well?
I'm sorry.
No,
Yeah, it's about the same. But you can take one class at a time. And that's going to, obviously stretch it out. So again, there's a lot of flexibility, but if you take 2 courses at a time, then you can get done in about the 18 months.
Double up. Yeah, that makes sense. Okay, so both of them are about 2 years. Awesome. Okay, third question we had coming in here is, how do you do the practicum hours for the courses?
It really depends on what class you're talking about, but typically it's identifying a preceptor, so it's a shadowing experience. So you're following. It's not the kind of clinical where you're starting IVs, or any of those kinds of skills that you've already learned. We totally recognize that you already have those skills. What it is the higher systems thinking skills. So the leadership, looking at assessment from a community perspective. So you'll actually do a windshield survey. So you'll drive around a community and write up an assessment of the community. You get clinical hours for that. So it's experiential learning activities where you're engaged hands-on. It could be like an interview with a nursing leader. So in some cases you need a preceptor. Most of the cases you'll need a preceptor, and you'll be shadowing, learning characteristics of a good, healthy leader versus characteristics of an unhealthy leader. Sometimes you can learn a lot from either situation, right? Even if it's not a healthy leader, if it's a situation where there's some toxicity, you can learn from that. So it'll be any kind of a hands-on experience where you're learning and engaging at the next deeper level. So more of a systematic approach to learning, in the bigger picture. That's what we call systems thinking in the healthcare profession.
Awesome. Another question that had come in is, do you guys offer a nurse practitioner program?
We do not, but the educator program can help prepare you for that. And then you'll just want to look for a postmaster's certificate nurse practitioner program. But I would love to have a nurse practitioner at some point, so stay tuned.
Yeah, and I love to ask that question because I know that we're continually developing our programs and adding new tracks and stuff, so I love that. Okay, next question that came in is it possible to start the BSN while finishing up my RN program?
Yes. So that is something that we are working on right now. That's an early admissions program. And if you are enrolled in your associate's degree program and you want to come on board, but you haven't graduated from your associate's degree program, you can do that.
Awesome.
So if you do that, we haven't really advertised about that yet. So you would want to, because it's brand new, so you would want to get in touch with me and just send me an email, Becky, I'm interested in the early admissions program. And that way I can fast forward your application to the right people, because our admissions folks are not trained in that program quite yet.
That's good to know. This is an insider scoop here. I love hearing this information. Another question had come in is, what would be one way that Regent's nursing program stands out amongst the other nursing programs?
I think, who we are. And let me, if you don't mind, just share some things of what other nursing students have said about us, because I think these are unique comments that you may not hear from other nursing graduates. But some things that they said is, the support here is absolutely wonderful, and staff and faculty are always willing to meet with me personally and assist me in any way possible. Another one said, Regent's nursing program combined with a faith-based approach fosters the kind of leader I aspire to be. The faculty and staff support me as a veteran, and the tuition discount is a bonus. I'm confident the program will help me reach my goals. Others have said the ease of access to the program and access to the library is wonderful. The instructors are caring and genuinely concerned about the student's success. Love that my faith is intertwined and encouraged. The faculty were always there for guidance and support. I learned the different leadership styles, which can make me a better leader in the future. Caring Christian professors were truly motivated to help students succeed and be the best nurse possible.
Wow.
And I think that's one thing that just right off the bat, I would say, you may or may not find that in another nursing school. I've worked in several. I know the history of nursing. I know that nurses can be very toxic at times, meaning that we can be bullies, not me, but some nurses are bullies. And that's just kind of like a vicious cycle that has happened in the nursing profession. So in our school of nursing, one of the things that we set out right away to do was to make sure that this was a culture of caring and excellence, but a place where students would feel respected, that their voices would be heard, in a place where hopefully they would feel our hearts, that, we're not just in this, to make money or, whatever it is that people do that are bullies. I don't know. But we want to make sure that we're always open-minded, that we learn from each other, and that you feel valued, because you are valued. And we do care about your opinion, and we want to learn from you. And so I think one thing that sets us aside, and the students have said it, as you heard in the quotes, is that we truly do care about each individual nursing student.
I love hearing that. And it just goes to show how we want to train up Christian leaders to, what they're doing isn't just for their self-glory or, just for the benefit of the patient, but it's really to just reflect on how thankful we are for what the Lord has done for us. And
that's right.
Give back unto him. So I love that you said that. Another question came in is the Healthcare Heroes Scholarship stackable with other scholarships or aid from Regent University?
I think it would depend on what the other scholarships are that you have. I probably would refer that one over to maybe John.
Okay. Yeah, and John can put that answer in there. And I know that you had said in one of those quotes, you said something about a veteran. Is there a specific military discount that's offered to our veterans?
John, can you speak to that?
Maybe if John or Priestley is there. If not, they'll go ahead and put it in the chat as well. So that would be super awesome. But yeah, other than that, I think that we have answered all our questions. There were a lot of good questions today. I know that you had asked before what type of nurses were joining us today, and I just want to share with you, we had some folks from the immunizations, which was really awesome. We had hospice, and we had rural healthcare nursing, and then allergy shots, which is awesome. And then I loved when you said labor and delivery. I'm actually 33 weeks pregnant, so I thank you for your service to
Oh,
us.
yay! Congratulations.
Yeah, so you guys, your field has been so inspiring to me over the last 33 weeks for sure.
Oh.
But folks, I do want to be respectful of your time, and we are coming to the end of the time of our webinar. So what I would love to do is just share some information how you can get connected with us. That phone number there, that will go directly to the School of Nursing. If you want to shoot us an email about any questions you have, please feel free to do so. Or if you'd love to just take some time and browse our website, please absolutely feel free to do so as well. But any final remarks before we close out tonight, Dr. Lee?
I don't think so. I think the biggest thing I would say is welcome. So welcome to the family, welcome to Regent, and I look forward to getting to know you.
Absolutely. And folks, keep asking questions. Feel free to continue to ask those questions, and our team of panelists will go ahead and answer those accordingly. But on behalf of Regent University, we are so excited for you, and we hope to see you soon. Please feel free to get in contact us if you have any questions. But it's been a privilege to serve you tonight, and I hope you have a great evening. Thanks, Dr. Lee.